Welcome to Urine Good Hands, the podcast where we dive into everything urology. Leading-edge treatments, education on a variety of topics, and expert insights to keep you informed and healthy. Brought to you by the Advanced Urology Institute of Georgia, where innovation meets compassionate care. Because when it comes to your health, you're always in good hands. As always, the information discussed today is purely informative and does not constitute medical advice. Hey, everybody, and welcome back. We're diving deep today into a topic that's, pretty important for men's health, prostate biopsies.
Yeah.
We've got some really cool materials here from Advanced Urology. This is some cutting-edge stuff. We're going to break it down so you can understand exactly what a prostate biopsy is all about.
Yeah.
Especially this MRI Fusion Biopsy I keep hearing about.
Right.
It's changing the game for prostate cancer detection, they say.
It really is. It's making biopsies a lot more accurate and less invasive, which is great news for patients, obviously.
Okay.
Yeah.
So before we get to all the fancy technology, let's start with the basics. What exactly is a prostate biopsy, and why would someone need one?
Sure.
I mean, it doesn't sound like a walk in the park.
You're right. It's not. But it's, well, think of it this way. A prostate biopsy is like a microscopic peek inside your prostate.
Okay.
Doctors take these tiny tissue samples and then examine them under a microscope. And that helps them figure out if there's any cancer or any other prostate conditions that need attention.
So it's not just a cancer test.
Exactly.
Hearing you say microscopic peek makes me wonder what other things they might be looking for.
Yeah, so it can uncover a range of issues. You know, sometimes men have high PSA levels. That's a protein produced by the prostate, which can be a sign of cancer, but not always.
Okay.
It could also be inflammation, infection, or even just like a benign enlargement of the prostate. A biopsy helps doctors really get a clearer picture.
Gotcha.
So they can make the right diagnosis.
Okay, so it's like a detective tool.
Yeah.
Helping to solve the mystery of what's going on in there.
Exactly.
Now, you mentioned different types of biopsies.
Yeah.
What's the difference, and why is this MRI fusion biopsy so special?
Well, each type has its pros and cons. You have the traditional transrectal ultrasound-guided biopsy, which uses ultrasound to guide the needle. And then there's the transperineal biopsy, which goes through the skin between the scrotum and anus.
Oh, wow.
But the MRI fusion biopsy, that's where things get really interesting.
All right, I'm all ears. Tell us why this one is so special.
Okay, so imagine this. You get an MRI scan of your prostate, which creates a 3D model, and it highlights any suspicious areas, like in bright colors.
Oh.
It's like a heat map showing exactly where the doctor needs to focus.
Well, that's cool.
Then during the biopsy itself, this MRI image is fused with real-time ultrasound images.
What?
It's wild.
So they can see it.
Yeah, it's like having GPS for your prostate, guiding the needle with crazy precision directly to those areas of concern.
Wow, that's amazing. It sounds incredibly precise.
Yeah.
But are there ever cases where this MRI fusion technology might not be the best option?
You know, that's a great point. While it's really valuable in many cases, there might be specific situations where a different approach makes more sense.
Okay.
And that's why it's really important to talk to your doctor. They can really assess your individual needs and figure out the best way to go.
Makes a lot of sense. So it's about finding the right tool for the job.
Exactly.
Speaking of which, if someone does need an MRI fusion biopsy, what's involved in getting ready for it? What should they expect?
Well, your doctor will give you specific instructions, but generally you might need to take antibiotics beforehand.
Okay.
Just to prevent infection. You might also need to stop taking blood thinners for a bit.
Okay.
And sometimes, though not always, you might need a bowel prep.
Oh, wow.
Yeah. But your doctor will let you know.
I bet some men are relieved to hear that bowel prep isn't always required.
Yeah.
So let's talk about what happens after the biopsy.
Sure.
How long does it take to get the results, and what do they actually tell you?
So it usually takes about 1 to 2 weeks for the results. And during that time, a pathologist examines the tissue samples under a microscope looking for signs of cancer cells. If cancer is found, it's given a Gleason score.
Okay, the Gleason score. I've heard that term before.
Yeah.
What does it actually tell us?
Well, think of the Gleason score as a rating system for prostate cancer.
Okay.
It helps determine how aggressive the cancer is, which helps guide treatment decisions.
Right.
For example, a score of 6 or lower is generally considered low risk, while scores of 8 or higher indicate more aggressive cancer. But it's not just about the number.
Okay.
The specific patterns of the cells under the microscope also play a role in understanding the cancer's behavior.
Interesting.
Yeah. It's like a roadmap to guide them toward the most effective approach for each patient.
That makes sense.
Yeah.
So depending on the Gleason score and other factors, what happens next? What are the possible outcomes after a biopsy?
So if the biopsy comes back clear, that's great.
Obviously.
But even then, continued monitoring might be recommended depending on your individual situation.
Makes sense.
If low-risk cancer is detected, your doctor might suggest active surveillance, which is basically keeping a watchful eye on the cancer and ready to take action if it starts acting up.
Gotcha.
But if the cancer is more aggressive, then treatment options like surgery, radiation, or hormone therapy will be discussed.
So there's a whole range of possibilities depending on the situation.
Exactly.
I imagine this is where having a trusted healthcare provider like the folks at Advanced Urology can really make a difference.
Absolutely. They're there to guide you every step of the way, answer your questions, and help you make the best decisions about your health.
So we've talked about the different types of biopsies, especially this amazing MRI fusion technology, what the results might mean. But what about the procedure itself?
Sure.
Is it painful?
Well,
what are the side effects?
It's normal to be a little apprehensive, but most men only experience mild and temporary discomfort.
Okay.
You might feel some soreness afterwards.
Right.
And it's common to see a little bit of blood in your urine, semen, or stool for a few days. Some men might have some trouble urinating for a bit.
Okay.
But these are usually short-lived. But it's good to be aware of them.
So it's not exactly a picnic, but it's generally manageable?
Yeah.
What about the risk of infection? Is that a major concern?
The risk is pretty low,
okay,
especially with the right precautions.
Right.
Your doctor will probably give you antibiotics beforehand to help prevent that.
To help prevent that, okay.
But it's still important to watch out for anything unusual.
So what should someone look out for after a biopsy?
Okay.
What are the red flags that something might be wrong?
So if you have a fever or chills, that could be an infection.
Okay.
And you need to call your doctor right away.
Right.
Also, keep an eye out for excessive bleeding, severe pain, or trouble urinating that doesn't get better. Those could be signs of a complication that needs attention.
So basically, any unusual or concerning symptoms, trust your gut.
Exactly.
And call your doctor.
It's always better to be safe than sorry.
Couldn't agree more. Now, we've mentioned Advanced Urology a couple of times.
Yeah.
And it sounds like they're a great resource for anyone facing a prostate biopsy.
They are.
Or who just has questions about their prostate health.
Absolutely. They offer expert guidance and support through the entire process.
It sounds like they really focus on patient care.
They do.
And making this whole experience as easy as possible.
They understand it can be a stressful time.
Right.
And they're committed to providing compassionate and comprehensive care.
Well, I have to say, I'm feeling a lot more informed about prostate biopsies now.
Yeah, me too.
It's not always the easiest topic to talk about.
Right.
But it's so important for men to be proactive about their health.
I completely agree.
Knowledge is power.
It is.
And understanding this procedure can help men make informed decisions.
Absolutely.
About their health care.
Yeah.
And remember, if you're concerned about your prostate health, or have been told you need a biopsy, don't be afraid to reach out to the experts at Advanced Urology. They're there to help you navigate all of this.
Early detection is key when it comes to prostate cancer.
Absolutely.
And Advanced Urology is really leading the way in providing the most advanced diagnostic and treatment options.
Well said. So we've covered a lot today.
We have.
From the basics of prostate biopsies to the incredible MRI fusion technology and everything in between.
It's been a great discussion.
I think it's time to wrap up this deep dive.
Yeah.
It really has. And, big shout out to Advanced Urology for giving us all this great information.
Yeah.
Their dedication to patient education is really impressive.
Definitely. They're real leaders in the field, and their commitment to men's health is, it's really great to see.
So to everyone listening, we hope this deep dive has given you a better understanding of prostate biopsies and, why they matter.
We covered a lot today.
We did.
Different types of biopsies, what to expect, the importance of early detection, talking to your doctor.
Right. Knowledge is power when it comes to your health.
It really is.
Don't be afraid to ask questions.
Yeah.
And get guidance from qualified healthcare professionals.
Like the folks at Advanced Urology.
Exactly.
They know their stuff.
Well said. So until next time, everyone, stay curious, stay informed, and keep on diving deep. If you happen to be in Georgia, you can always check out Advanced Urology Institute of Georgia. They've got 10 convenient locations throughout Metro Atlanta. You can make an appointment by calling 678-344-8900 or go online to www.advancedurology.com.
Great advice.